Do you know what secondary trauma is? Many of us don't. We focus primarily on primary trauma, being directly involved in the trauma. Secondary trauma is when we are hearing about the trauma, hearing details about it, seeing it on the news, maybe seeing it on social media, witnessing it but not being directly involved. So for instance, first responders witnessing aftermath of sexual assault repeatedly, nurses and medical staff seeing trauma patients coming in. They're not involved in the trauma, but they are experiencing the trauma. And so over time, mental health professionals, we are trained in ways to manage it and also seek our own therapy for it. So what can happen with secondary trauma is similar to PTSD in that you may have hypervigilance to safety, you may have recurring nightmares, you may have flashbacks, and sometimes that flashback can create this fantasy part in your brain too, where you start to imagine the trauma itself. If you're hearing about it, your brain starts to create the imagery and it actually feels like you are witnessing it as well over time. Emotional detachment or numbness can occur. Intrusive memories, intrusive thoughts, I think I already mentioned. You could have feelings of hopelessness. You could have raging. You could have experienced increased anger in situations. You could develop beliefs that the world's not safe. Some become kind of cynical. So all of these things are happening, and it doesn't get the spotlight that it should, because we often talk about the person who was directly involved. And we need to take care of ourselves with secondary trauma as well. Seek professional help. Monitor your symptoms. Don't downplay them because, well, I wasn't involved, right? So don't say it's my job, I signed up for it, because I don't think anybody signs up for what you actually see as a first responder or in different professions. So take care of yourself, seek help, look for some resources, and understand that secondary trauma is a thing. All right. Take care of you.